Welcome to Copilot Podcasts. Imagine knowing about a disease outbreak before it even happens. That's not science fiction anymore. Today, we're diving into how artificial intelligence is revolutionizing infectious disease management, from predicting outbreaks to transforming patient care. By the end of this episode, you'll understand why AI adoption in healthcare isn't just innovative, it's urgent.
What's really fascinating is how AI is already changing the game in disease surveillance. Take Blue Dot, for example. It was one of the first systems to detect those unusual pneumonia cases in Wuhan that later became known as COVID-19.
Wait, really? An AI system spotted COVID before humans did?
Yeah, and that's just the beginning. AI-driven early warning systems like HealthMap are now analyzing real-time data from various web sources to identify emerging pathogens faster than ever before.
So it's like having a global health radar system?
Exactly. And what's really powerful is that these systems can differentiate between similar pathogens, like SARS-2 and influenza viruses, enabling more targeted responses.
That's incredible. But what about actual diagnosis? How is AI changing that?
Well, according to recent research, AI is significantly improving diagnostic accuracy. For instance, AI can analyze medical images like chest X-rays to diagnose viral pneumonia, often with greater precision than human doctors.
More accurate than human doctors? That's pretty remarkable.
It is. And what's particularly exciting is that these AI systems are performing well even with limited data, which has been a major bottleneck until now.
That seems counterintuitive. Don't AI systems usually need massive amounts of data?
Traditionally, yes, but recent advances in AI methodologies are changing that. This is especially important for low-income countries where data might be scarce.
Let's talk about treatment. How is AI helping there?
AI is revolutionizing drug discovery. It's being used to screen vast chemical libraries and predict drug-target interactions with unprecedented precision.
So it's speeding up the process of finding new treatments?
Exactly. And not just speeding it up, AI is helping identify novel therapeutic approaches that might not be obvious to human researchers.
You know what I find fascinating? The connection between weather patterns and disease outbreaks. How does AI factor into that?
That's actually a great example. AI systems can analyze weather patterns along with mosquito populations and reported cases to predict dengue outbreaks, allowing for preemptive interventions.
That's amazing. It's like connecting dots we didn't even know were there.
Precisely. And according to Professor Moritz Kramer from Oxford's Pandemic Sciences Institute, in the next 5 years, AI will transform how we prepare for pandemics.
How so?
By analyzing terabytes of climatic and socioeconomic data, AI can help us better anticipate where outbreaks will start and predict their trajectory.
Let's talk about remote monitoring. That's become huge since COVID, right?
Absolutely. AI-powered remote patient monitoring systems are transforming how we track and manage infectious diseases outside of hospital settings.
How exactly does that work?
These systems use various sensors and wearable devices to continuously track patients' health metrics. AI algorithms then analyze this data in real time to detect early signs of deterioration.
So it's like having a virtual doctor monitoring you 24/7?
In a way, yes. And studies have shown that patients monitored through AI-enhanced systems experience fewer complications and hospitalizations.
That must have huge cost implications for healthcare systems.
Exactly. By preventing hospital readmissions and emergency room visits through early detection and intervention, these systems can significantly reduce overall healthcare costs.
But there must be challenges too, right?
Oh, definitely. Data privacy concerns, potential biases in AI systems, and ethical dilemmas are significant challenges that need to be addressed.
What about integration with existing healthcare systems?
That's another major challenge. Electronic health record systems aren't always advanced enough to handle AI integration, and there are concerns about the reliability of AI results.
So what's being done to address these challenges?
There's a push for stringent regulatory frameworks and inclusive databases to ensure equitable, ethical, and effective AI utilization in healthcare.
And training must be important too, right?
Absolutely. Healthcare providers need proper training to understand and effectively use these AI tools. It's not just about having the technology, it's about knowing how to use it properly.
What about the future? Where do you see this heading?
The potential is enormous. AI could help us not just respond to diseases, but predict and prevent them before they become major problems.
That's pretty exciting.
And what's particularly promising is how AI can help us understand the interactions between the immune system and emerging pathogens.
Which could lead to better treatments?
Exactly. And not just treatments, it could help us develop more effective vaccines and preventive measures too.
You mentioned earlier about AI working well with limited data. Can you elaborate on that?
Sure, recent advances in AI methodologies mean we can now get meaningful insights even from smaller datasets, which is crucial for rare diseases or in regions with limited resources.
That could be game-changing for global health equity.
Absolutely. It means we can potentially develop effective solutions for infectious diseases everywhere, not just in well-resourced healthcare systems.
What about cost? Isn't AI implementation expensive?
Initially, yes, but studies show the long-term cost savings through prevented hospitalizations and more efficient care delivery often outweigh the initial investment.
That makes sense. It's about the bigger picture.
Exactly. And as these technologies become more widespread, we're likely to see costs decrease while capabilities continue to improve.
So what's the most urgent need right now?
The most urgent need is probably standardization, creating common frameworks and protocols for AI implementation in healthcare settings.
To make sure everyone's speaking the same language, so to speak?
Exactly. We need standardized approaches to data collection, AI model validation, and implementation protocols to ensure these tools can be effectively deployed across different healthcare systems.
It sounds like we're at a crucial turning point.
We really are. The next few years will be critical in determining how effectively we can harness AI's potential in fighting infectious diseases.
What keeps you up at night about all this?
The biggest concern is ensuring these advances benefit everyone, not just those in well-resourced healthcare systems. We need to make sure AI doesn't widen existing health disparities.
That's a really important point.
And it's why the work on making AI effective with limited data is so crucial. It could help level the playing field in global health.
As we wrap up, what's your message to healthcare systems still hesitant about adopting AI?
The evidence is clear. AI isn't just the future, it's the present. The cost of not adopting these technologies, both in human and economic terms, far outweighs the challenges of implementation.
And the potential benefits are enormous.
Absolutely. From earlier disease detection to more effective treatments, AI is transforming every aspect of how we fight infectious diseases.
Well, that brings us to the end of today's episode of Copilot Podcasts. Remember, in the race against infectious diseases, AI isn't just a tool, it's becoming our most powerful ally. Thanks for listening.